Hi, good day. I am Andrea Isabel de la Rosa, and today I will be discussing about SARS, or the Severe Acute Respiratory Syndrome. SARS is a viral respiratory disease. SARS first appeared on China's Guangdong province on November 2002, and scientists identified it in February 2003. It has spread to over 24 countries before it has been contained by health authorities. There were 8,098 cases worldwide and 774 deaths. The spread of the severe acute respiratory syndrome resulted to the first human pandemic of the 21st century. Signs and symptoms. SARS has flu-like signs and symptoms, such as fever, chills, muscle aches, headaches, and occasional diarrhea. After a week, the signs and symptoms includes fever that are around 38 degrees Celsius or above, dry cough, and shortness of breath. Most patients that have been infected with SARS were healthy adults ranging from 25 to 70 years old and fewer among children under 15 years of age. Source of infection. SARS is a zoonotic disease. It originated in animals and is passed on to humans. Zoonotic diseases are infections that are transmitted from animals to humans. Exotic animals from Guangdong market are said to be the immediate origin of the virus. These animals are said to be palm civets and raccoon dogs, but these are not proven. Mode of transmission. SARS is an airborne virus and it can be transmitted through close or direct contact, through droplet nuclei when someone carrying the disease coughs, sneezes, or talks, and it is vehicle-borne for it can be spread indirectly via contaminated surfaces. These surfaces have been touched by someone who is infected by the virus. Pathology. SARS is caused by a strain of coronavirus, the same family of coronavirus that causes colds and influenza. SARS may lead to development of pneumonia and is fatal in some cases. SARS is fatal in certain cases and it is usually due to respiratory failure. Many people infected with SARS develops pneumonia, breathing problems, can be extremely severe that a mechanical respirator would be needed. Next is the prevention and control measures. CDC's control measures for preparedness and response. Command and control. This is to determine and establish operational authority for outbreak response. Surveillance. This is to maximize early detection of cases and to identify and monitor contacts of infected people. Preparedness and response. This is to identify and isolate all potentially infected patients immediately and for the implementation of infection control practices and contact tracing. Community containment is used to prevent community transmissions. Prevention of travel transmission risk is to reduce the risk of transmission among travelers. Laboratory diagnostics is to ensure that lab diagnostics are used safely and appropriately and that results are appropriately interpreted. Communication and education is to provide accurate information about the disease and to maintain the confidence of the public that the health system has the ability to respond and manage the disease. We also have the investigation and research, also for the further study of the SARS, and infection control. This is to ensure the early recognition of patients at risk and to prevent transmission by implementing appropriate precautions. Lastly is information technology. This is to deploy an integrated data management system the outbreak response needs. Lastly is the ways to prevent transmission. Wash hands frequently, wear disposable gloves if touching any body fluids, wear surgical mask when in the same room with a person that has SARS. Disinfect surfaces that may have been contaminated with the virus and wash all personal items used by a person infected with SARS. Also, COVID-19 is almost just the same with SARS. It is just a different strain of coronavirus, so keep in mind that social distancing and wearing a face mask is vital with both SARS-CoV and SARS-CoV-2. Listed are the sources where I gathered the information I included in this topic. You can view them for further reading. That would be all. Thank you.